All right-sided murmurs increase in intensity with inspiration. Well, why? Inspiration is an active process. When I want to inspire, what I do is I will contract my diaphragm, pull it downwards. When I pull it downwards, I expand my thoracic cavity. When I expand my thoracic cavity, I am pulling on my parietal pleura away from the visceral pleura that's attached to the lungs. That is going to increase the volume within your pleural space. Remember, when volume goes up, pressure goes down. And in your intrapleural space, typically you have a negative pressure. Say it stays at about -5. It goes from -5 to -8. When it does that, it becomes a much more stronger suction force. It's going to suck open that alveolus. It sucks in air from the positive atmosphere, and that brings in oxygen to your lungs. The same way, when you inspire, this creation of negative pressure is going to suck blood in from the rest of your body into the right side of the heart and bring it to the lungs, and stays there because the negative pressure keeps it there. So all right-sided murmurs increase in intensity on inspiration.